Welcome back to Movement Project. Tim Rumentor, Doctor of Physical Therapy, and everybody seems to know about the impact of your rotator cuff on your shoulder function and how rotator cuff surgeries are one of the fastest growing procedures done in the entire world. But the neglected rotator cuff of the hip is the topic of this video. Most people don't even know one exists, so let's show you how you can maximally train it to avoid injuries and pain of your hip and knee. The first exercise we want to do is non-weight bearing internal and external rotation of our hip. We're starting with external rotation. So the rotation is when this thigh bone is twisting, rotating in and out. So we start with external rotation by lifting the knee, keeping the heels together, keep that position. Then we go into our internal rotation. Then we drop back down, bringing the knees together, keeping the heels apart, and then bring the heels back together. And then you just cycle through that. Knee, back down. So it's knee, ankle, knee together, ankle together, knee apart, knee together, ankle together. From there, we progress to do the opposite, which would be internal rotation first, followed by external rotation. So we go ankle, knee, ankle, knee. Ankles apart, knees apart, ankles together, knees together. You want to keep your back up and down like it would be pressed against the wall for both of these exercises. Ankle, knee, ankle, knee. If you rotate back, you're not working your hip rotators. You're just bringing in help from your hip flexors, and that's not what we're looking for on this exercise. Next on the list of hip rotator cuff strengthening to help your knee and ankle pain is hip circles. You want to start off by making sure you have a straight line from your shoulder to your hip, to your knee, to your ankle, and then from there, you're just doing small grapefruit-sized circles of that entire leg, keeping the knee straight. Okay, you want to try to stabilize your upper body so that you can get more focused movement in the hip. Take your way through 15, 20, 30 reps and then change directions of your circles. It's a good idea to try to stay flat with this exercise. We don't want you propped up because then you're changing the mechanics of the hip and bringing your obliques in a shortened position, which impacts your hip function. I guarantee you, you'll notice a difference from one side to the other, especially if you have any type of hip, knee, or even ankle problems. Saving the best and most difficult hip rotator cuff strengthening exercise for last, we have a loaded internal and external rotation semi-squat exercise. So I'm in a position where my left leg is internally rotated to start and my right leg is externally rotated to start. That means I'll be strengthening the left external rotators while I'm strengthening the right internal rotators. Now we're doing this from a stretched position, so it's very difficult. If you've never done anything like this before, you definitely don't want to start off trying to do this. Another key piece is that a lack of internal rotation range of motion is linked with hip arthritis and all kinds of other hip problems. So you want to be careful. If you can't even get into this position, you want to reach out to a physical therapist or other movement specialist to help you improve your hip mobility so that your chances of needing hip surgery or hip replacement at some point go way down. So what we do, we start in this position and we have a load here. I would start without a load, but if you can tolerate a load, great. And you're just driving down from your ankles, lower leg bones, and then you're just coming up to that kneeling position. All right, and I'm gonna work through my repetitions. I'm trying to use as much of my hips as I can. I'm trying to straighten my hips as I come up. I'm getting in that fully extended position. Now, if this produces any knee pain, you want to steer clear of this exercise because it does put a bit of torque through your knees. Switch directions and take yourself through, starting off probably just in the 5 to 6 rep range and then try to build up from there. When I get to that 8, 10 rep, I start to feel a little bit of discomfort in my knee, especially on the outside for myself, so that's where I cut it off. But certainly doing this exercise without any load is going to be just fine. Just make sure you're able to get the knees down on the ground. If you get in this position to start, you can't get this down flat. At the same time that you can get this knee down flat, you're not allowed to do this exercise. It's going to give you a problem. But I can get here, easily put both sides down, and from there I can just drive up and down. Like any of my videos, remember, no exercise should ever cause you any type of pain. So be sure to reach out to a movement specialist, physical therapist preferably, if you have any difficulty with any of these movements.